welcome to Comcast Newsmakers. I'm Sabrina Register. We are in Lakewood today at the Boys and Girls Club, and joining me right now is Washington Secretary of Health, Mary Selecky.
Nice to see you,
Nice
Sabrina.
to see you, Secretary. We have a lot to talk about. Whooping cough. We have not seen numbers like this in decades. It's now an epidemic, yes?
Absolutely, and I've been Secretary of Health for 13 years, and I've never declared an epidemic before. We have more cases than we've ever seen. It's 10-fold larger than last year, so we do have a serious problem here that can be prevented.
Why so bad right now?
Well, you know, the bug really seems to have gotten hold of Washington State. We were watching the number of cases rise, and last year we had about 950 cases or so, and we surpassed that by March. So we really do have a problem. About every 3 to 5 years, whooping cough shows up in the state. It's a bug. There are a lot of bugs. It's always here. We always have cases. We have an under-immunized population in our young children, so we need parents to get their kids' immunizations up to date.
So that means they may have had 1 or 2 of the
Right.
doses, but not the full amount.
Right. A child, by the time they're age 3, would get 4 shots for whooping cough, and 1 more before they're 7. But there's also a booster, and it's really important. Our 11, 12-year-olds should get the booster, our teenagers should get the booster, and you and I should get the booster.
So explain, because some people might be watching right now and say, I don't have to worry about this. My kids have been immunized. I got the full, I got all 4 for them. I've been immunized, so why should I worry? But you're saying the efficacy of the vaccination over time goes down.
Yeah, it wears off. You know, this is a vaccine that what we've learned kind of wears off over time, which is why we need a booster. And actually, the booster is fairly new. We haven't had it prior to 2006. So, for example, when I went for my flu shot in 2007, they asked me if I wanted to get this booster shot, and I said yes. And it is a combination that's diphtheria, tetanus, and pertussis, or whooping cough. It's Tdap is what it's called. I'm seeing signs on pharmacies that say we have the whooping cough booster shot, so we know that it's easily accessible in this state too.
So when people get this booster shot, it will protect them from getting whooping cough. So even if they've been vaccinated, you can still get whooping cough. So this is why you get the booster. But more importantly, because it would only be a mild case, more importantly, you get the booster to prevent that person from spreading it to a newborn who cannot be immunized yet, right?
Right. And let me give you an example. About 20% of our cases are in children under age 5. And we're surpassing 1,300 cases, and the number continues to grow. A child under 5 may be a very young baby, for example, and of the hospitalizations, 19 of them are babies under 3 months, and those babies aren't even immunized yet. And once they're immunized doesn't mean all of a sudden they have all the protections. They have to get 4 shots before they're 3 years old. So we're protecting those babies. But there are also people like you and I who can't get any kind of shots because we're what's called immunosuppressed. And so we want to protect and cocoon our adult population. This is really about a contract that I as an individual have with my community. I'm going to get the shot so I don't spread something to somebody who might get it.
Whooping cough is that barking cough, almost like a seal. So some parents might say, okay, so you get a cough. How bad can it really be? But there have been cases where babies have been hospitalized and sadly have even died from whooping cough.
In the last 2 years, 4 babies have died, and basically, they choke to death. They start to get a coughing fit. And as described by a mom to me, it was the scariest thing she ever experienced in her life. She had to rush her baby to the emergency room where the physicians were able to open up the baby's air pipes. And what happened was the doctor said, who's been sick? And the mom realized it was she, and she didn't even realize that her dry, hacking cough was whooping cough, and she passed it to her child. That's the scariest thing, and no parent should have to go through that. So we really want everybody to get their booster shot and get their kids immunized.
And we're out of time, but I just want to mention that there are clinics now where people can go and get that booster shot. Thank you, Secretary. Thanks for watching Comcast Newsmakers. Headline news at the top and bottom of the hour. Hope you can stay with us.